Uh, Nowadays, we are discussing about the important topics and important question which can be or more than expectation in NEET PG exam. So the students they are aware of this fact that small topics which is very important they ignore it or they forget it. So let us discuss one by one. Now, important is that what are the mydriatics and what is cycloplegic drugs in eye. Cycloplegic means paralysis of accommodation, that is ciliary body. All mydriatics have some cycloplegic except phenylephrine. So, phenylephrine only mydriatic effect, no cycloplegic effect. Tropicamides, that is the short acting mydriatics. It will last for 4 to 6 hours.
Okay.
So this is very important. Now let us see what is the difference between myopia and hypermetropia. In myopia, eyeball is large and light get focused in front of or anterior to the retina. So we can correct by concave lens, that is minus or diverging spectacle.
Okay.
Just opposite hypermetropia, eyeball small, light gets focused behind the retina and it corrected by placing convex plus lens. Okay?
Okay.
Now, myopia is the most common refracting error. This is very important, है ना? So, let us see astigmatism. What is astigmatism? The cornea is not a uniform spherical surface and is curved differently in different meridians. So, when the cornea has its greatest and least curvature at right angle to one another, it is called regular astigmatism. In the commonest form, the vertical meridian is more curved. The condition is called with the rule. And reverse is said to be against the rule. So, astigmatism two types. Regular astigmatism. In the commonest form, the vertical meridian is more curved, that is with the rule, and opposite is against the rule.
Okay.
Okay. So, now what are the signs of aphakia?
Aphakia.
Yes.
Okay.
Deep anterior chamber, jet black pupil, iridogenesis, and only 2 Purkinje's image seen. Only 2 Purkinje's image seen.
Okay.
Okay. So before that, we discussed about Purkinje-Simpson image. Okay.
Okay.
Purkinje-Simpson image or Kaptoprite image results from reflection from the refracting surface within the eyes. So these are 4 types of this. Okay. So Purkinje image anterior corneal surface. P1. P2 is posterior corneal surface. P3 anterior lens surface. And P4 posterior lens surface. That is inverted image.
Okay.
So image P3 and P4 are absent in aphakia. Very important.
Sure.
Image P3 and P4 are absent in aphakia. Okay. So these are the signs of aphakia. Now we discuss about some instruments. Okay. What is the retinoscopy? What is sonography? Keratometry. So retinoscopy, objective method to determine refractive errors in the eye.
Yes.
Keratometry measures curvature of the cornea. And this Emsler grid ekpota. This is to detect maculopathy and macular degeneration.
Yes.
Or
the image of it was there in the exam, like Directly the instrument
Yeah,
photo was there and the principle of the instrument was asked.
yeah. What is the some instrument already given there,
Hmm.
like Placido disc. Now, what is the function of Placido disc?
Hmm.
Where it is used? This is very important. Okay.
Okay.
Some chart is given, analyst chart.
Hmm.
So these are the some instrument. Visually, you can observe this.
Hmm.
So in discussion, we ignore this. Okay.
Okay.
Now we come to the conjunctivitis.
Okay.
So itis means inflammation.
Right.
It may be bacterial conjunctivitis,
Okay.
viral conjunctivitis,
Hmm.
adenovirus keratoconjunctivitis,
Hmm.
ligneous conjunctivitis, or angular conjunctivitis.
Okay.
So there are so many conjunctivitis. The first is bacterial conjunctivitis, most common due to Staph aureus.
Hmm.
Here the corneal margin and lid margin involved. Streptococcus pneumoniae and H. influenzae is there a subconjunctival hemorrhage. Okay, and there is mucopurulent discharge, matted eyelashes, sticky eyes. So in case of bacterial conjunctivitis caused by Staph aureus, Staph pneumonia, and H. influenzae.
Asian friend. Hmm.
So there is mucopurulent discharge.
Hmm.
Viral conjunctivitis, adenovirus. Most common is a pink eye.
Pink eye. Right.
Yeah. Herpes simplex, picornavirus, pink eye, watery discharge, subconjunctival hemorrhage. There may be follicle or pre-follicular lymphadenopathy. These are the viral symptoms of viral conjunctivitis. Okay.
Okay.
But in case of adenovirus keratoconjunctivitis, also there is pink eye.
Okay.
All the signs above viral.
Hmm.
It may be due to occupational hazard for ophthalmologist.
Hmm.
Now, angular conjunctivitis is important, most common, and classically due to Maxilla lacunae or gram-negative diplococcus, diplobacillus.
Okay. Gram negative. What's the name?
Gram-negative diplobacillus, Moraxilla lacunata,
Moracella.
Moraxella,
Okay.
Moraxella retinata. Okay, Moraxella,
Acha.
XXE double LA,
Acha.
Moraxella, MORAXE Moraxella lacunata.
Hmm.
Okay,
Okay.
Moraxella only, Moraxella species.
So Diplococcus gram
So,
negative.
yeah, gram-negative diplobacillus.
Diplobacillus. Okay.
Yeah, it may cause by Staph aureus also.
Okay.
Usually associated with acute chronic alcoholism and malnutrition.
Acha. Malnutrition associated.
Malnutrition associated.
Hmm.
One is very important is flectinular conjunctivitis.
Sub
Flectinular conjunctivitis.
flexineural.
Flectinular. Phlykctenular. Flectin.
Okay.
This is type 4 hypersensitivity reaction.
Oh, type 4.
Type 4.
Hmm.
Reaction to endogenous tuberculoprotein
Hmm.
or due to Staphylococcus blepharitis.
Hmm.
Okay.
Okay.
Second is superior limbal keratoconjunctivitis.
Acha.
It is associated with Graves' disease of thyroid.
Hmm.
These are the most common.
Okay.
Now, one very important is vernal keratoconjunctivitis.
Vernal.
Vernal.
Kerato.
It is also known as spring catarrh.
Hmm.
Commonest in spring season, one climate.
String cataract.
Yeah, spring catarrh.
Right.
Now, Most children and young adults type 1 hypersensitivity reaction होता है.
It is a type 1.
Yeah.
So we can compare with the
Itching,
form 1. It was type 4.
Flickton conjunctivitis.
Right.
Flickton is type 4.
Ah,
Keratoconjunctivitis,
type
vernal
1.
keratoconjunctivitis type 1.
Type.
So, due to external erosion, now intense itching,
Hmm.
mucoid stingy or ropey discharge.
Okay.
मैक्सवेल लियोन साइन उसको बोलते हैं.
Hmm.
Cobblestone papilla.
Cobblestone. Cobblestone
The
papilla.
picture, the cobblestone picture may be given and बोले what is this? What is the positive organism or what is this condition?
Right. So
So cobblestone papilla
image of
or
cobblestone
under,
papilla is important.
cobblestone papilla where? On under surface of upper eyelid.
Hmm.
This is important, है ना?
Okay.
There is alkaline tear.
अच्छा.
ठीक.
ठीक है.
Now trachoma.
Glaucoma.
Trachoma is very important. Is it due to chlamydia trachoma type A and C?
Hmm.
Trachoma serotype A and C transmitted by direct contact with fomites.
Hmm.
Serotype D and K cause inclusive conjunctivitis or chronic follicular conjunctivitis. So, though 4 variants A, C, and DK.
अच्छा.
Chlamydia trachomatis serotype AC transmitted by direct contact with the fomites.
Okay.
But in serotype DK causes inclusion conjunctivitis or chronic follicular conjunctivitis.
Okay.
Clinically, there is scarred limbal follicle that is known as Harvard spit.
Harvard spit.
Yeah. Conjunctival scarring. So, normal limbal follicle that is Harvard spit. Conjunctival scarring. This is known as arch line. ARLT. ARLT. Arch line on upper tarsal conjunctiva.
Okay.
Now we can grading this trachoma by Fisto grading. Fisto, FISTO.
Okay, this may be asked.
Yeah, Fisto grading, WHO grading.
WHO Fisto grading. Okay.
Fisto grading. So what is Fisto grading? F for follicular trachoma.
Okay.
I for intense inflammation.
Hmm.
S for trachomatous scarring.
Hmm.
T for trichiasis.
Okay.
And O for corneal opacity.
Okay.
So this is Fisto classification.
Hmm.
Now, next we come to the ophthalmia neonatal.
Okay.
Ophthalmia neonatal conjunctivitis in newborn within first 4 weeks postpartum.
Hmm.
So timing is important. Within first 4 weeks.
First 4 weeks.
And within month, है ना? Is called ophthalmia neonatal. Most common causative organism, chlamydia trachomatis.
Same.
Serotype D and K.
Okay.
Serotype D and K.
Hmm.
And one is that pinguicula. Now, what is pinguicula?
Pinguicula.
It is a fatty yellow pinguicula. Pinguecula. Pinguicula. It is the fatty yellow elevation triangular nodule adjacent to limbus.
Right.
Usually nasally.
Nasally.
This is very important. Nasal side. Usually nasally.
That's MCQ.
It is triangular nodule. Second is pterygium.
Pterygium.
Ptery. Pterygium. Literal meaning is that wing or flashy bulbar conjunctival proliferation usually begin nasally. ये भी nasally develop करता है.
Okay.
It usually begins nasally. Degeneration of the collagen. Okay.
Okay.
With the thinning of the overlying epithelium and occasional calcification. So, दोनों में difference, how we difference pinguicula and pterygium. Pingula is fatty, yellow, triangular,
Right.
and there is elastic degeneration of collagen.
Okay.
Here is wing or wing septate in bulbar conjunctiva began nasally due to degeneration of the collagen with thinning of the overlying epithelium.
Okay.
So this is this. Now, one is the limbal dermoid.
Okay.
Limbal dermoid usually, what is the site? Very important. Limbal dermoid usually inferotemporal quadrant of limbus.
Okay. Inferotemporal.
Inferotemporal quadrant can involve cornea also and can have hair also.
Okay.
Okay.
Okay. Done.
So there, last year, 2024, this limbal dermoid picture was given and asked what is this.
Okay.
So this is limbal dermoid.
We have discussed a lot about ophthalmology. These are both important questions for INI CT and both in NEET PG. And
Yeah.
the topics are important. The topics get repeated again and again.
Yeah.
So
So it is a lot of question here. Now, what is herpes zoster ophthalmica? Singles.
Right.
Caused by varicella zoster virus. One is their Hutchinson sign.
Hutchinson sign. Yes, that is the question.
Hutchinson sign is involvement of external nasal nerve.
Okay.
External nasal nerve which supplies the side of the tip of and side of the root of the nose. Correlates significantly with subsequent development of ocular inflammation since it is terminal branch of the nasociliary nerve. So external nasal nerve is the terminal branch of nasociliary nerve. So whenever there is involvement of the side of the tip and side of the root of the nose, you must think about herpes zoster.
Okay.
It is most common in AIDS patient, immunodeficiency.
Okay.
One important photograph here, there is a ring filtrate in acanthoma keratitis.
Okay, we'll check in the Google.
Picture acanthoma keratitis. Radial ring infiltrates in a radial keratoma, severe pain. So these are all picture. It may become with picture.
Okay.
One important is keratoconus.
Keratoconus, yes.
Keratoconus, yes. So irregular ring keratoscopy, we can see early sign is keratoscopy, irregular ring, seizure reflexes on retinoscopy, and in direct ophthalmoscopy, oil drop sign.
Oil drop sign.
Oil drop sign. And there is Vogt stria. Vertical line.
Right.
Vertical line. So maybe there may be picture and say what is this? In which condition there is this picture comes. So this is early sign of keratoconus.
Okay.
Okay. Now one question is that what is keratopathy?
Keratopathy.
Vortex keratopathy.
Cornea. Any
Cornea,
disease
yeah.
associated with cornea, yes.
Yes. So two terms here. Vortex keratopathy and band keratopathy.
Vortex, okay.
Vortex keratopathy or cornea verticillata. So there is symmetrical bilateral hole-like pattern of powdery white or yellow corneal epithelial deposit. This is important. Symmetrical bilateral hole-like pattern of powdery white or yellow corneal epithelial deposit. It is caused by Fabry's disease.
Fabry disease.
And some drugs like amiodarone, chloroquine,
हाँ.
indomethacin,
Hmm.
tamoxifen,
Hmm.
all this.
Right.
Okay.
Okay.
So vortex keratopathy
Hmm.
found in Fabry's disease.
Right. There are
Now band keratopathy.
Fabry disease is also a storage disease, and amiodarone, one question comes like it has iodine in it, the drug which has only
Yeah.
iodine, and even chloroquine
Yes.
has the highest volume of distribution, so it causes a lot of vortex keratopathy deposited in
Vortex
the cornea. So it has been asked
keratopathy.
as a question,
Yeah. So there is whole like pattern.
whole like pattern,
Now was band keratopathy.
band keratopathy.
Band keratopathy is the deposition of calcium in Bowman's membrane.
Okay, calcium in Bowman's
Now,
membrane.
yeah.
Hmm.
So chronic anterior uveitis,
Hmm.
especially in juvenile rheumatoid arthritis.
Right, JRA.
Silicone oil in anterior chamber,
Hmm.
chronic corneal edema, severe chronic keratitis.
Hmm.
These are ocular causes. Okay.
Right.
Another cause may be sarcoidosis. So this is two grade. Okay.
Okay.
Now, vitamin A deficiency, xerophthalmia.
Xerophthalmia.
This is also important.
Hmm.
So there are so many grading X1, X2, X3, XN, XS, XF.
Okay.
So these are different types of progression of the disease.
Right.
So I don't think that it will ask this grading.
Maybe, like
So
it may ask the which the grading and staging, like it may ask what is the involvement of the layers in a particular stage.
not
Like what
layers,
what,
but
what is the basis or principle of grading and staging in xerophthalmia?
it is based on the progress of the disease.
Right. So which involvement of which
Suppose there are
layer?
only in one X1 conjunctival xerosis.
Right.
In X1A, conjunctival xerosis without bitote spot and with X1B with bitote spot.
With so bitote spot
X2
is important.
cornea xerosis. Important is XN. XN means night blindness.
Night blindness.
Earliest manifestation.
Right. So this is kind
Yeah.
of a question.
Yeah. XN, night blindness.
Excel.
Yeah. So these are important. One is let us escape all these things.
Hmm.
Mm, come to the cataract,
Cataract.
lens opacity.
Right.
So there is some important this posterior subcapsular cataract, conjunctival cataract. All the these are types of cataract.
Hmm.
So uh, two or three is important. Uh, One is Morganian cataract. What is Morganian cataract?
Morganian. Hmm.
Yeah. So Morganian cataract is a hypermature cataract
Hmm.
in which liquefaction of the cortex has allowed the nucleus to sink inferiorly.
Okay.
This is important. Okay.
Okay.
So Morganian cataract is hypermature cataract in which liquefaction of the cortex has allowed the nucleus to sink inferiorly. Okay.
That.
Yes. Well drop cataract
Hmm.
is seen in galactosemia.
Right.
Sunflower cataract
Hmm.
seen in Wilson's disease.
Right.
Excess copper deposit. Okay.
Hmm.
Other is one is a rosette cataract. Where is this rosette cataract? Still cataract. Well drop microphilia.
Right.
Posterior subcapsular cataract.
Yeah, that is
Most
important.
visually,
Once question was there, like you have to differentiate between different types of cataract and which location is there actually, which is present in a particular eyeball. So,
yeah. So posterior subcapsular cataract,
hmm,
most visually handicapping even in the early stage, owing to the position of the opacity near the nodal point of the eye.
okay,
So there is more blurring in bright sunlight and headlight on of ongoing coming car. Headlight on coming car. Okay.
okay,
So this is posterior subcapsular cataract,
hmm,
earliest, most visually handicapped.
right,
Two terms, anterior subcapsular cataract and posterior subcapsular cataract.
hmm,
So anterior subcapsular cataract caused by electric cataract
okay,
or corticosteroid induced cataract is posterior subcapsular cataract.
okay. So, what is a corticosteroid induced?
Corticosteroid induced.
Okay,
Now, one is snowflake cataract.
snowflake,
Snowflake is classical in diabetic cataract.
right, diabetic one,
Snowflake cataract.
hmm,
And sunflower cataract is Wilson disease.
Wilson disease, right,
Wilson disease. Okay.
done.
One term is rosette cataract.
Rosette, yes.
Rosette cataract seen in which disease? There is a picture like rosette.
Okay.
So it may come. You give me picture and what is this? And what is the cause of this
It is a
rosette
rosette
cataract?
cataract that's seen in blunt or penetrating trauma to the eye.
Yes, traumatic cataract. It is a traumatic cataract.
Traumatic cataract.
Bossious ring pigment on anterior lens capsule due to constricted people striking lens during blunt trauma.
Right. Blunt trauma.
Okay.
Okay.
So traumatic cataract, there is rosette.
Done.
Yes.
We'll wrap up in 6 minutes.
Yeah. Time is up.
Hmm.
So now what are the causes of posterior capsular opacification?
Sure.
So most common complication of cataract surgery is PCO, posterior capsule opacification.
Okay. Only cataract surgery.
It is also known as after cataract or secondary cataract.
Right.
It is occurs when the posterior capsule and part of the anterior capsule are left behind in situ.
Hmm.
After extracapsular cataract extraction,
Hmm.
sutureless small incision cataract surgery, and placo-emulsification.
Okay.
So posterior capsule opacification is the after cataract or secondary cataract.
Thank you.
This is important. So what are the causes of this? So these are all causes the posterior capsular cataract.
Hmm.
So let us close today.
Okay. So we have this. Let's discuss what we have seen today. I summarize in 5 minutes. What are the
Yeah.
topics we have discussed? So we have seen the cycloplegics. We have seen the errors of refraction, myopia. We have seen it's the most common error of refraction. The types of astigmatism we have seen. We have seen the signs of aphakia. There are some Purkinje images which are absent uh, in aphakia signs. There are instruments we have seen. There is Placido disc, retinoscope, and many other. There is types of conjunctivitis we have seen in the bacterial. The most common was the Staph aureus one. The viral, there's a
Yeah.
pink eye, the adenovirus, the angular due to the gram-negative moraxilla. There is a diplobacillus. It is associated with the
Yeah.
malnutrition. There is a plexinular type 4 hypersensitivity. There is endogenous. Sorry, there is endogenous tubercular protein it was associated with. There is vernal keratoconjunctivitis, that is the spring cataract. And okay, so there is a type 1 hypersensitivity. So cobblestone papilla image was there. We have to know there is an undersurface of the upper eye. In the trachoma, there is types. There is different types of like Fisto WHO classification grading. So there is ophthalmia neonatalum. There's first
Neonatal.
yes, and neonatalum. So first week or the first month, first 4 weeks or the per month, it's caused by chlamydia trachomatis. Then difference between pterygium and pinguela. So sorry, pinguela. So it's a fatty yellow triangular deposition in the limbus. It's not pinguela. And pterygium, it's a wing-like structure. The nasally it is
Pingula.
present in the limbus. It's pinguela. And
Pingular, not
limbodermoid
pingular, pingular, not pingula.
pinguela.
Huh.
Right. Okay. So there is a Hutchinson sign in the herpes zoster ophthalmicus. There is keratoconus, oil drop sign, and Vox tria. There is a keratopathy, vortex keratopathy in Fabry disease, amiodarone, chloroquine also. There are many other drugs which causes vortex keratopathy, hold like there is band keratopathy in the calcium deposition in the Bowman membrane. There are grading of the xerophthalmia, vitamin A. So XN is the night blindness, the early manifestation. There is different types of cataract. Morgagian cataract is a hypermature one. Galactosemia, the sunflower one, present in the Wilson disease. There is a rosette present in the traumatic eye injury, and there is a posterior subcapsular due to corticosteroid induced. The snowflake for the diabetic one, and also there is a after surgery, after cataract or the secondary cataract after the most common cause after the cataract surgery. So just can you summarize like everything, like how to study in 1 minute, how to study for NEET PG for only in 1 minute? Can you summarize? Like, what should be the approach of the student?
So the thing is that all line by line is not necessary. You just read any textbook where there is highlighted only this extra ages or the silly things silly difference between just one, for example, that there is 10 layers of the retina, and there is retinal detachment. So what are the which layers is involved in retinal detachment? So you must stress on this. Now, second is that this suppose there is conjunctivitis. So there is so many types of conjunctivitis.
Right.
So you have to see there what are the causative and what are the different minor clinical difference. So you have to just catch these points.
Oh,
Okay. Yeah.
tell you. So this is the first lecture. So it was successful. Okay, we'll meet again tomorrow. And
Okay.